Hi, thank you, Surekha, and welcome everyone. Thank you for joining us on a Friday afternoon. We really appreciate it. As Surekha has already provided a brief on what the symposium is about, um, one of the very significant themes in the symposium is on advancing the accountability agenda for sexual and reproductive health rights. Surekha, can you confirm if you can see my presentation there?
Yes, we can see it.
Okay, great.
Yeah,
Thank you.
please go ahead.
So I want to, before I begin, I just want to acknowledge that the curation and content design of this session has been a very participatory process, and I want to acknowledge the contribution of my colleague Mata Shah from Columbia University, Shashodra Das Gupta from NFI India, Deepa from Sama, and Victoria Boydell, who were part of the core group of the program committee that is looking at this theme within the symposium. What I want to do through this presentation is describe the background and rationale, the framing, and the anticipated discussions that we want to have under this theme during the 3 days of the symposium. To begin with, I will provide a context to where we stand vis-a-vis accountability in the field of SRH rights as of now. Over the past 20 years, especially, there's been a growing interest in accountability within the SRH field. And a lot of this has come through the fact that large global health initiatives have pushed certain parts of the SRH agenda. The in the MDGs, goal 5, which was looking at maternal health, and now also with the SDGs, where some of the aspects of SRH have been included within the targets and the indicators. These have sort of drawn attention to SRH rights in both a way that amplifies them at the global level and draws attention to it and resources to it. But one of the fallouts of it has also been that it has limited the focus. And primarily what you see happening in terms of interventions are around maternal health and family planning. And there are a lot of other important concerns around access to contraception beyond the framework of marriage and married women, safe abortion, sexuality education, sexual health needs of diverse populations, which have completely been neglected. Uh, this is part of how verticalization has been happening in public health, but within the SRH field, this is a real matter of concern because when the ICPD agenda was drafted in 1994, the attempt was actually to broaden how we understand sexual and reproductive rights. And over the past two or three decades, what has happened is that it, instead of operationalizing that vision of the ICPD, in many ways there's been a limitation of the agenda. Not to say that this has happened without any opposition. There has been constant engagement with civil society groups along the way, which have pushed for this agenda to be broadened, to be to address various needs of various different kinds of people and so on. But predominantly the kind of social accountability practice that you see is framed within maternal health and family planning. uh, the main understanding of accountability, not just in SRH but also otherwise, is that of upwards accountability. So there is accountability towards donors, towards global health initiatives. There's a lot of monitoring of quantitative targets at the higher levels. And because of the nature of sexual and reproductive rights, sometimes this has also led to concerns around coercion, choice, acceptability. And these are some of the emerging concerns for sexual and reproductive rights now. Uh, Mainstream social accountability practice that exists in the SRH field is largely consisting of bounded interventions within a predetermined framework of entitlements. So, for example, if you are looking at maternal health, the idea is to see whether the range of entitlements which have already been set out in policy have been received or not received. What this has done is it has closed off conversations around what are emerging violations. And that is one of the reasons why we also want to bring in the fact that different kinds of women face different kinds of violations. And all of these need to be addressed, not just what is promised within entitlements. And there's also a constant need to re-examine the framework of entitlements and to include what is required to address the needs of diverse kinds of women also. Um, the central role of the struggle of women, which is in a sense the core of sexual and reproductive rights, has somewhere in this got lost. And the accountability agenda has become a managerial exercise, and this is a critique of social accountability across health, and also in other fields like education and so on. But for sexual and reproductive rights, it acquires a significance because sexual and reproductive rights as it is are a very contested field, both within the communities and also in women's relationship with the state. So there is a concern around an increased interest in sexual and reproductive health in a very limited way, but then there is also a very vibrant and emerging practice across the globe where community groups and community-led action is actually trying to push the boundaries of this agenda and make it more meaningful. So that is the context in which we are talking about uh, social accountability in this symposium. What we are trying to do through the symposium is to showcase some of these community-led accountability efforts that are trying to push the boundaries. And these are happening across COPASA's region. COPASA's regions are primarily in the global south, but we also have some practices from the north. We want to try and illuminate the emerging SRH concerns that can be tackled through accountability efforts, but have remained neglected in mainstream practice, especially around the growth of the private sector and various emerging kinds of violations. We want to create opportunities for sharing practice and for also sharing concerns across regions, and building solidarities so that we are able to identify opportunities for local, subnational, national, and global actors to identify what shared priorities there are and what are the ways in which concrete collaborations can be forged to advance the agenda of citizenship and accountability within SRH. Just to provide a sense of where you will find sexual and reproductive rights within this symposium, there is the most concentrated place where this is happening is the thematic sessions, which happen on the morning of the three days, and all 5 themes will have parallel sessions at this time. So there are 3 thematic sessions which will happen on day 1, 2, and 3, which I will talk about in some detail. In the afternoons, there are the interthematic sessions where also I'll tell you about where you will find conversations on SRH and accountability happening. There are satellite sessions which happen on day 0, which is the 15th of October, many of which are also addressing the SRH theme. And finally, there are the posters and creative presentations where a lot of participants have are going to be making presentations about their practice. To take this further, there are 3 arcs of conversation that are going to happen within the SRH theme. On day 1 is understanding and addressing social hierarchies through SRH and accountability work. As I'm sure you're well aware, the struggle for realizing sexual and reproductive rights is deeply influenced by gender-related social norms and various axes of inequities and injustice prevalent in societies. What we are trying to do through this session is interrogate how these inequities influence sexual and reproductive rights and what elements must form part of an accountability practice, both at the interface of communities with health systems, but also within communities and within the health systems themselves. So we have speakers who are presenting their practice of working with various various marginalized communities, and the explicit focus on excluded groups and stigmatized SRH rights and services, we are hoping will raise important conceptual and practice concerns for mainstream accountability approaches. For instance, we have a group that's talking about organizing Dalit women in India and how they see health rights within the larger agenda of demanding rights for the Dalit women. We have a presentation from somebody working in Ethiopia who's specifically working on maternal health with nomadic pastoralist women. We have a presentation from Peru, where an activist is talking about the concerns of indigenous women, especially around coercion and choice. And we have a presentation from Uganda where somebody is speaking about what are the strategies that they have used to organize youth in slums in a broader context of democratization. And I'm just trying to provide a little bit of flavor of the geographic diversity and the groups who will be speaking, not to go into the details of these presentations. On day 2, we are moving towards the relationship between global actors and their impact on SRH and accountability. In the field of reproductive health, as you know, there are multiple systems for monitoring progress, especially in the domains of maternal health and family planning, that have been established at the national and global level. First during the era of the MDGs and now also through the SDGs. And this session is going to hear from the experiences of practitioners who are seeking to link local community realities with these global accountability mechanisms and the strategies that they have adopted, and why they've adopted those strategies, what are the inherent challenges that they face, especially around the disjunct with grassroots realities, the receptivity of governments to recommendations from these forums, and the overall effectiveness of these global mechanisms. So we have people who are engaging with the SDGs, with the Universal Periodic Review process of the UN, with the Convention for People Living with Disabilities, from legal litigation at the European Court of Human Rights, and also trying to interrogate what accountability of donors is and what accountability of organizations to donors and governments to donors means for citizens. Finally, on day 3, we have a session that's looking at current practice. And as I said before, there's a broader critique of social accountability, which poses this challenge to social accountability, that it needs to be not driven by tools, but by strategies and by politics. And what we are trying to do in this session is to take accountability practice in a deeply contested field like sexual and reproductive rights, and see how it engages with various levels of state, from the policy and politics to health facilities at the front line of service provision and within communities itself. Mainstream social accountability work in the field of maternal health and reproductive health, as I said, tends to involve these very bounded interventions and issues arising out of tensions between state policies and what citizens want, especially in issues like access to contraception, abortion rights, menstrual hygiene management, the right to express one's gender and sexual identity, and so on. These are some practices that we don't see enough of. The session aims to both showcase practice, but also to critically evaluate tools that we have been using. Some tools which are commonly seen in social accountability practice, including scorecards, engagement with health committees, increasingly the use of information and communication technology. How do we critically evaluate, engender, and make these tools more political, such that they are of leverage and use to advance the sexual and reproductive rights agenda? So in this theme, in this conversation, we have a presentation from China, which is looking at the tension between population control policies and preserving women's autonomy, uh, regulating the private sector in India, which is giving rise to a whole range of new kinds of violations in reproductive health, particularly around unindicated procedures, patients' rights, autonomy, and so on. We have a very nice critique of health committees from Mozambique, which examines the power relations within these health committees and really questions how much power do citizens really have in a mechanism of this sort. We have the use of scorecards, which are a very traditional mainstream social accountability tool being used in something like access to safe abortion in Uganda. We have a practice of using ICT to address informal payments in India. And finally, one very important presentation on how do you encourage men's accountability to gender equality, given the fact that sexual and reproductive rights are so rooted in social norms, and it is not just the responsibility of women to change or to struggle for change in those social norms. So these are the three arcs of conversation that will be happening in the morning of the 3 days, 16th, 17th, and 18th of October. We would like a relatively stable group to stay for the 3 days, because as you will also see, the conversations build upon each other, and the learning synthesis of this theme has great significance in that we are touching upon the theme of leaving no one behind, and global practices and critically evaluating tools, all of which are interrelated. So a lot of the conversation is going to be carried on from one day to another. Further, the design of the sessions is such that it uses the practices that people are presenting only as a trigger to spark a discussion. More than half the time in all of the sessions is dedicated to a conversation between the participants, and we are hoping that we will be able to allow for sufficient time for also reflection on our own practice and what we are doing in the fields, and to take away something constructive from this for our practice. In other spaces in the symposium, SRH features in the following ways. There are three satellite sessions which are focused largely on sexual and reproductive health. One that is being organized by Arrow and its partners on right to safe abortion and experiences from their various partners in the Asia Pacific region. There's one presentation, one satellite session, which is looking at strengthening social movements to adopt and to integrate sexual and reproductive rights, especially maternal health, within their programming and their advocacy agenda, which is being done by the National Alliance for Maternal Health and Human Rights in India. And there's one which is looking at practice of men's accountability for gender justice, which is being hosted by CHSJ. In the interthematic panels, the World Health Organization and the Independent Accountability Panel are co-organizing a very interesting talk show kind of a format, which is drawing on the World Health Organization's recent systematic reviews on what works in social accountability. They have, it's a very, very interesting conversation because it is positioning what universal health coverage is going to mean for SRH accountability. What are the specific areas for advocacy that need to be brought into the conversation on UHC? It is also trying to see what do we mean by SRH accountability in humanitarian contexts, in context of conflict and natural disasters and so on. It's also drawing on the WHO's own systematic review recently, which is looking at how context plays a role in what works in social accountability. What are the strategies that work under which circumstances, and what that means for our practice. So that is a more, it's not a very grassroots presentation of practice, but is presenting more synthesis of reviews that the World Health Organization has been doing. And of course, the Independent Accountability Panel, which is one of the key global entities that is looking at accountability in the context, especially of maternal and child health. There is one more panel which is specifically looking at accountability of health rights for persons with diverse sexual orientations, gender identities, and expressions. This, of course, is not limited only to sexual and reproductive health rights, but that is also one of the issues that is going to be discussed at that panel, especially moving beyond the entire focus on HIV/AIDS and STIs in the community. There are a range of very, very interesting posters which are looking at how has disrespect and abuse been addressed through accountability work, scorecards for broader access to SRH rights, experience with accountability bodies like the maternal death reviews in India, various kinds of civil society action to advocate for safe abortion rights, and also fighting discrimination towards HIV positive persons. So as you can see, there's a very, very, we've tried to broaden the agenda beyond maternal health and family planning to a large extent. And we are also trying to ensure that we have representation from various contexts, because sexual and reproductive rights are so context specific. The politics, the culture, the history of feminist movements in every context has a very, very important role to play in what kind of entitlements are available, what are not available, and what kind of advocacy history exists in places. So we are hoping that this is going to provide a very rich canvas for practitioners, for academics, and of course for activists to engage and to also see what are the kinds of common concerns that we have that we can advocate for together. So I will stop here and end with a call to join the conversation. As I said, the speakers only bring a very small part of the participants' experience. There is a lot more experience in the room when we have these sessions, and we want as many concerns and as many rights agendas from various perspectives that we can bring together to emerge. We want you to present your strategies of accountability work, but also learn from the work of others, and we hope that will help all of us critically reflect on what we are doing at the moment and what we need to do differently or in a more effective way. And ultimately, the objective of this is to strategize on ways to move forward. So here's hoping that participation in this theme will be significant, and we will have sufficient time and space to discuss, debate, and build solidarities. Thank you so much. I'm happy to take any questions. Yes, please go on.
Yes, hi, Sana. It's Vashi Hazard here. I was just wondering whether you could give us, say, a kind of program that lists the rooms and where these sessions are going to be, because I certainly will be there for the full period. I want to follow the discussions all the way through. But I've been to the Habitat Center, and I do get lost, so it would be very helpful if there's some kind of
Yes. So the program is now finalized to a large extent, and what the secretariat is doing is they're allotting the rooms based on, they're trying to have some kind of a logic as to keeping some kind of consistency in the thematics and so on. So you should hear from the secretariat about the exact rooms in which sessions are going to be happening, I think by the end of next week. So they will also have a map and things like that. So I hope that will help with navigating the space, but also navigating the themes. What we are also trying to do is for people who are interested in following a certain theme, like you've said, to be able to show them where are the spaces where this conversation is happening, so that if you followed the entire theme throughout the symposium, you would have a fairly comprehensive view of what is happening in the field at the moment, and what COPASA's interest and positions are vis-a-vis a lot of these issues. So I think you should be hearing from the Secretariat about this by next week for sure. And regarding your presentation per se, you will hear about that from the facilitator of your session. So if you're presenting, say, in my theme, whoever is the facilitator for that particular session will contact you, say, early next week to have a conversation with you about what is the format in which you'd like to present, what are the key points that you would like to make, and so on.
Okay, wonderful. All right, thank you.
Are there any other questions, queries, ideas for, yeah, thanks, Neha. I hope you will be there for the 3 days. And I hope you will bring in your very, very important expertise into this as well.